My name is David Stickler, and I'm a neurologist, and I've been in Charleston for about 8 years, and I moved here from Raleigh. In Raleigh, I was doing 2 fellowships at Duke University, one in neurophysiology and one in neuromuscular disease. I grew up in Pennsylvania. I left Pennsylvania for Florida and went to Florida Tech, where I did a degree in electrical engineering. I left engineering for medicine after that and went to West Virginia and did a 4-year medical school, followed by a trip back to Florida to do my neurology training at the University of Florida. Left neurology for North Carolina to do my training and ended up in Charleston. As I got into engineering, I found that I was a problem solver. I like to figure out, how things worked and how things didn't work. And I think medicine's very similar. When I do a neurologic exam, I'm figuring out a problem. Where is your problem at? Very similar to engineering. And then once I know the problem, how do I fix it? Engineering as well. When I got to medical school, I was very convinced I did the right thing. I got into a class of brain anatomy. And, we got a case, I've got a weak left arm. Where's the problem? Very similar, following the circuit, following the neurons, where do they go, how do they work? So I think there's a very close relationship, and all the engineers that I've known have made great doctors.
Neurology is a branch of medicine dedicated to the study and treatment of nervous system disorders.
So neurology is a field of medicine dedicated towards the study of the brain. And it's really more than the brain. The neurologists take care of the brain, the spinal cord, the peripheral nerve, the muscles. So it's much more than the brain. Things that we deal with in neurology tend to be either inflammatory, degenerative, hereditary. Some examples include dementias that are more degenerative, things like Parkinson's disease, which are movement, but also things that are what we call paroxysmal. They come and go, like headache disorders and seizures. So a wide range of diseases that we do treat as neurologists.
At Neurology Specialists of Charleston, our board-certified physicians are leaders in the field of neurology and treat a variety of conditions, including back or neck injuries, headaches or migraines, EMG, nerve conduction studies, epilepsy, vision changes, neuromuscular disease, peripheral neuropathy, muscle pain and or muscle weakness, tremors and or twitches, and more. Interested in learning more about the services and treatments available through Neurology Specialists of Charleston? Visit our website.
As a new patient in our neurology clinic, you're going to get first a review of what you've had done. Many times, if you're coming for a headache or a tremor or neuropathy, somebody has worked it up before, and we would want to review all that information to determine what we can do and add. The next thing we'll do is learn a little bit about your history, what medications you're on, what surgeries you've had, things that have been done. Then we're going to talk to you, learn about your problem, do a comprehensive neurologic exam to figure out what the problem is, and then come up with a plan. What are we going to do to figure out why you have the problems you're having and how we can treat them or make them better? I think that the neurology patient interaction is fairly unique. We take care of a lot of chronic conditions in neurology, things that people are going to have once they're diagnosed, they're going to have for life. And it's not going to be a constant stable life. There's going to be a lot of disease manifestation that we deal with over the years. And I think it's important to have a very good relationship with your doctor when you have one of these neurological conditions. Not only do we have ways to treat now, but even 10 years after I'm out of my training, things are different. I look back at what I did a decade ago, and it's a little bit different than what I do now. And so patients that I treated one way, I'm treating that same patient different 10 years later. And so I think it's important that you have that good relationship with your neurologist, because you're in it for the long haul when it comes to neurologic disease, and something that we build on as we go on. The neurology exam is quite unique, and it's really a bit of detective work. What we do is we do motor testing, look at your strength, look at how you're feeling, look at your eye movements, look at your coordination, all trying to figure out where the problem is. If you come in and you're weak, it could be from a brain problem, a nerve problem, a spinal cord problem. We can pick up things in our exam to really let us know where the problem is. So everything we're doing on our exam is to try to help figure out where the problem is. Headaches in neurology are very common, and they can be a very disabling condition. The key is to really get the correct diagnosis. Everyone, doesn't have migraines. You can have a different type of headache, like a tension headache or a cluster headache, and all the treatments are very different for the headache types. What the goal is, one, is to get you the right diagnosis, and then two, the right treatment. When we talk about headache treatment, there's really two forms. One is, I have a headache, how do I get rid of it? And that's the abortive therapy. The other type of therapy is what we call preventative therapy. There are many times you go on a medication to prevent the headache from coming. And it's really important to know a lot about your medical history, what other medications you're on before we begin that type of treatment. But people who have more than 2 or 3 headaches in a week really do need that preventative headache treatment.
Interested in learning more about headache treatments available through Neurology Specialists of Charleston? Ask a member of our staff for more information.
Neuropathy is a very common neurologic condition, and the way people come in with neuropathy is they're numb and they tingle. And often it's in the feet. They'll lay in bed at night, the feet will burn, they'll be numb, they'll be tingling, and that can progress over time. And so when you have that diagnosis, the key is to really figure out whether or not you have a treatable form of neuropathy. Treatable meaning, do you have undiagnosed diabetes? Could you have bad thyroid disease? And so there's a run of tests that we do to figure out, do you have a treatable cause of neuropathy? And then we focus the management on that treatment. In addition to the treatment of the cause, we also have treatment of the symptoms of neuropathy. People who burn, I can't go to bed at night, my feet hurt so bad, we have treatment for that as well. And it's important to manage both the cause and the symptoms of neuropathy.
Do you suffer from neuropathy? Request an appointment with Neurology Specialists of Charleston to see if neurology treatment can improve your quality of life.
We also have varying procedures and tests that we will do in office. The main one will be electromyography and nerve conduction, but we'll also be offering Botox injections, not for cosmetic reasons, but for headache or for abnormal muscle tone. We can do Botox injections. We'll also be doing lumbar puncture or spinal taps to look at spinal fluid for inflammation or infection. We'll also likely be doing skin biopsies to look for causes of neuropathy as well. Patients want to know, if I have a disease that's not curable now, will it ever be? I think there's hope. If you look at all areas of neurology and take, for example, motor neuron disease or ALS, ever since Lou Gehrig had the disease, we really haven't developed a good treatment or cure for this condition. I think in the last half decade, the technology and the research that's gone into ALS has been tremendous, and I think we're getting closer. There are things that I treat now. If you take, for example, a condition called myasthenia gravis. Gravis means grave. People would get the condition and they would not live through the condition. Now, it's 3 times a year in the clinic and check your blood to make sure the drugs are working okay, and people live, high-functioning lives. So a lot goes on from decade to decade in neurology, and we fully expect things that may not be treatable now to be treatable in the future.
Interested in learning more about the services and treatments available through Neurology Specialists of Charleston? Visit our website,